community-based participatory action-oriented research. That's what I would say. I'd say, you know, when you start a research project, making sure that there are people that you're doing research, that the community of interest is a part of the leadership of that research initiative, whatever it may be, right? If you're doing research on people of color, why not instead do it with people of color? If you're doing research instead of on trans people, with trans people, right? And that means deviating a little from the traditional scientific Western method, right? Where it's not, I'm going to come up with a hypothesis in my silo, and then I'm going to test it in the external world. But instead, it's, I'm going to go to the community or communities, it's not really a monolith, and talk to people about what the priorities really are in this area, right? Because my one mindset of what needs to happen might actually be really different from what people on the ground actually really need. And so that's the community-based, the participatory action model is also to get people to the table and designing this research with you. I did this with trans kids back in Virginia, and it was great. I, as one trans person, had some ideas of what research we should do. Trans kids had so many other brilliant ideas, and theirs were far better than mine. And so we all came to different hypotheses together, right? We were action-oriented. So there was an ethical approach to this. At the end of the day, it was how do we then create meaningful action in the communities that are giving us this data, right? So it was action-oriented. And then it was, you know, we did this research, we did it responsibly. It means disseminating in a way that is actually understandable to the community you're doing research with, right? So it's not going off to the New England Journal of Medicine and publishing something, and that's it. That can be helpful, but it's also going to these communities and, you know, maybe there's a multimedia presentation of what the results are, right? Maybe there's a zine that is distributed, right? There's lots of different ways. Maybe it's an Instagram reel, but there's lots of ways that we can be innovative about the education of clinical trials that we're doing. And honestly, that just gets more marginalized communities or minoritized communities interested in science.
Yeah. I think now would be a TikTok.
Yeah.
And I would say, I mean, yes, all of that. And if you are that one, and so some people wonder about like, okay, but as one person, what could I do if I'm involved in that process? If you can get yourself onto an IRB and get them to start adding community participation lines into everything that goes through the IRB for approval, it will change what you're doing. It will make, and it will give you so much better data. Like it will just be better science if you are working with people instead of observing them under a microscope.